So, in answer to a message regarding lowering cholesterol naturally, the reason I'm making a video is that nothing in natural medicine is as simple as, oh, yeah, take this for that. And so I thought I'd make a video and send it out because this is a super common question. So, lowering cholesterol. There, in the medical industry, has been a correlation between elevated cholesterol and increased risk for cardiovascular disease. I would like to suggest that elevated cholesterol is not the cause of increased risk of coronary artery disease or cardiovascular disease, but that there's an underlying level of inflammation that then increases the likelihood of elevated cholesterol and of cardiovascular disease. That inflammation is really the underlying cause. So what can we do about that? First of all, I often talk about 3 legs of a stool. I talk about this for pre-diabetes and diabetes prevention, but also inflammation prevention and lowering cholesterol. So in this same message, it was mentioned, I eat oatmeal, I work out, what else can I do? So food is one leg of the 3-legged stool. Movement is another. The third, just as important as food and movement, is stress management or nervous system support, however you want to look at that. That might be meditation, prayer, anything, any practice on a regular basis that helps your system say, that gets you out of your head, into your body, sensing your body, feeling your body, taking slower, deeper, more complete breath, longer exhale than inhale. This can be done through meditation, yoga, tai chi, prayer, whatever does it for you. So those 3 legs of the stool are just as important. Someone can be incredibly anxious about eating the right way, and they may have lengthened the diet leg of the stool, but they shortened their stress management leg or their nervous system balance leg, in which case eating well is actually doing them harm because they're so stressed out about it. So what you eat, how you move, and how you're managing this crazy world and how you're soothing your nervous system. Those are the 3 main points. I'm also going to direct you to my weekly webinar because I talk a lot about how to find out which foods work for you. That was the 2nd week of the webinar, which was 2 weeks ago. It gets a little blurry after a while. I believe in the Nourish section, I talk about how you decide what foods work for you. And I'm going to give you a case example here as far as blood type goes. So here in Oregon, in the last few years, I had a patient come in who was living a very stressful lifestyle. Her cholesterol was almost at 300, her total cholesterol. She was pretty convinced that it was just hereditary because her mom and other family members had very high cholesterol as well. So she was assuming that it was familial hypercholesterolemia. And yet she wanted to just see if I had anything to offer. And so she was a blood group O. She is a blood group O. And for her, she was trying to be more vegetarian. And I said, I would like you to increase your animal product consumption, organic, so that you're not getting additional hormones and pesticides and chemicals within your system. And let's recheck in 3 months. And sure enough, when she increased her animal protein, her animal content, her animal intake, her cholesterol went down because she was a blood group O. Blood group O's can utilize dietary cholesterol and metabolize it. If she were a blood group A, I would have advised the opposite. Blood group A's don't tend to utilize cholesterol from their diet very well. They don't recycle it very well. And so excess animal products in a blood group A can very likely increase cholesterol. The last piece that ties it back to the nervous system, which I think is just as important as anything else, and it often gets neglected, is that nervous system piece. Cortisol is one of your stress hormones. And if you look at the biochemistry, normally here if I were to talk about this with a patient in my office, I would have a really geeky biochemical pathway sheet that says cholesterol is a starting molecule. Think of it as the top of this like domino chain. Cholesterol is the starting molecule. It goes over to feed estrogen and testosterone and progesterone. It also goes down to feed cortisol, one of your stress hormones. So think about that. If your body's making tons of cortisol down here, it has to request to your body to make all of the things upstream so that it can then feed down to make cortisol. So the more stressed we are, the more likely we're asking our body to make more cholesterol. Another reason to manage stress is to help lower your cholesterol. Now, there is some research as well about eating more fish in your diet or taking fish oil supplementation can help decrease your cardiovascular disease risk. I'd much rather have, if you were my patient and this person who asked the question is someone that I love. And so my first and foremost suggestion is really look at lifestyle, look at ways you can live in more complete alignment with what your body needs, and use supplementation just that, as supplementation. Don't rely on supplementing with fish oil to be the answer, but looking at nervous system, diet to match your physiology, movement to match your physiology. And again, I'm going to make a plug for my webinar series, weekly Thursdays, 2 p.m. I always get the time change confused. 2 p.m. Pacific, 5 p.m. Eastern on Thursday afternoons. You can register through Zoom. You can find the link through my bio and Instagram, through links in Facebook. And I hope that you can join me because I think you'll learn a lot about living according to what your body needs, making choices accordingly. And yeah, I want all of my loved ones to feel supported and live according to how our bodies want to live and need to live, and try to offset this crazy world, especially in this crazy time. Okay, love to you all, and hopefully I'll see you at my webinar, Tune Into Your Body, on Thursday afternoons. Take care.